Okay, the next question is, what are the treatment options for low testosterone? Now, let's start with lifestyle changes. To naturally boost your testosterone, you can do things like eat a better diet, decrease carbohydrate intake, increase that good protein and fat intake. That's going to help boost your testosterone because you need all those nutrients for your body to be able to build those hormones and also keep hormonal balance. Number 2 in lifestyle changes would be getting good sleep. If you're not sleeping well at night, your body's also not producing enough testosterone, most likely. So unfortunately, also not having enough testosterone makes it harder to sleep, so it can be a vicious cycle. The second treatment option that you might have heard of is androgel, and this is something that is commonly prescribed by primary care practitioners when they see that your testosterone has dropped just below 200. They give it to you and it boosts your hormone levels to just above 200. So I guess you feel a little bit better, but you're not going to see any dramatic results with that. And on top of it, it's a pharmaceutical drug. And so that means you're going to have plenty of more possible side effects from it too. And you're not even getting that good of results. If you want real, dramatic, healthy results, then you need bioidentical testosterone replacement therapy. And even with that, there's a few different options. So the first one, and probably the one I prescribe the most, is injectable testosterone. And so this means 1 needle injection once per week. And this way it keeps your hormone levels very stable because you inject at the beginning of the week and that testosterone level lasts the full week until your next injection. This consistent dose really prevents you from having a lot of the side effects of your testosterone going up and down too much. So if you hate needles, you might be a little bit unsure about the injectable testosterone. I'll probably still try to convince you to do it, but there are other options, luckily. So one other option is the pellet. And this is actually like what it sounds like, a tiny pellet, but it actually gets placed under the skin in the small of your back. And you only have to do it every 6 months, which is super nice because you really only have to worry about it every 6 months once you get to that optimal dose. The disadvantages of the pellet would be we can't easily adjust your dose. So that means if you need more testosterone, we have to do another procedure to put that pellet under the skin. If you need a little less testosterone, then you kind of just have to wait it out. And we're very cautious, so we're never going to cause any huge negative side effects. But if you're doing injectable testosterone and we want to go up or down based on how you're feeling or how you're doing and how the results you're getting, we can easily do that just by changing your dose the next week. The other downside of the pellet testosterone would be that over time you could get some scar tissue. So this is especially important for young men that are considering the pellet. If let's say you're 30 years old and you need testosterone therapy, I wouldn't necessarily start with the pellet because if you have to do that every 6 months for the rest of your life, you're eventually going to get some scar tissue. Now, if you're an older man, like over 60, then maybe the pellet's the right best option for you because it's easy. Now, if you don't like the injection and you don't like the idea of something going under your skin, don't worry, there are other options too. The other 2 options are a cream, and that's something that you just pump out. You can just rub it on your inner arm or on your inner leg, and it's once a day. So when you wake up in the morning, get out of the shower, when all those pores are nice and open is when you would rub that cream in. Testosterone creams are pretty easy. The downside of it is you can't get a huge boost from testosterone creams. So, and for some men, it's perfect. Let's say they're at their testosterone levels at 400 and they need to get to 600. It's possible with a cream. But if they're at 200 and their optimal level's 1,000, a cream's never really going to cut it for them. The other downside is you have to be careful that you're not transferring that cream anywhere. So let's say you put the cream on and then you jump in bed with your wife later that night. You don't want to have it rub off. Usually an hour is enough time to wait. So if you put it on first thing in the morning and get dressed, generally it's not an issue. The other one besides the cream is the troche that I mentioned, and that's like a little tablet, but it dissolves in your mouth. And similar to the cream, you can't get as huge of a testosterone boost. You can boost your numbers a little bit, get some effect, but sometimes for men it's just not enough. And the other downside would be that sometimes you need multiple to get the highest dose, and it doesn't taste that great. So why don't I just take a capsule for testosterone? Wouldn't that be easier? Unfortunately, no. Testosterone is really not good for your liver. So if you take it as a capsule, that means it has to be processed by your digestive tract and your liver. If you are able to just dissolve it in your mouth, then you can bypass the liver and go directly into the bloodstream. Same with the cream, similar to the injection. If you want to learn more about your testosterone therapy options, just contact us at Silk Life Medical Spa for your free consult. This was just one of the frequently asked questions about male bioidentical hormone replacement therapy. So please go to my YouTube channel to see the video in its entirety. Bye!